Hello everyone, today we are going to see about what is coronary angiogram and what is coronary angioplasty. And we are going to see that why it is done. And how it is done. In the cath lab. Let's get started. What is a coronary angiogram? The coronary arteries supply your heart muscle with blood. They can become clogged from a buildup of cholesterol, cells or other substances, plaque. This can reduce the flow of blood to your heart. If a blood clot forms and blocks blood flow through that artery, a heart attack may occur. Why do I need this test? A coronary angiogram is a special X-ray test. It's done to find out if your coronary arteries are blocked or narrowed, where and by how much. An angiogram can help your doctor see if you need treatment such as angioplasty or stent, coronary artery bypass surgery or medical therapy. Now we'll see what is angiography. Angiography is an imaging technique that uses X-rays to take pictures of blood vessels and chambers of the heart. A small amount of contrast media is squirted through a catheter into the vessel or chamber of interest, while a series of pictures is taken. These can be assessed individually, or run as a film, providing accurate images of the inner lumen of vessels and chambers of the heart. Now we'll go to next topic, that is, coronary angioplasty, also called percutaneous coronary intervention, is a procedure used to open clogged coronary arteries. Angioplasty uses a tiny balloon catheter that is inserted in a blocked blood vessel to help widen it and improve blood flow to the heart. And why it is done. Angioplasty is used to treat the buildup of fatty plaques in the heart's blood vessels. This buildup is a type of heart disease known as atherosclerosis. Now we are going to see how the coronary angioplasty procedure, done in cath lab. First they will puncture the femoral artery or radial artery with puncture needle, then they will advance the sheath. After advancing sheath they will administer heparin and other anticoagulants to prevent clotting. After that they will advance guiding catheter with the help of J-tip wire to the aorta and positioning at the level of coronary artery. After positioning the guiding catheter they will take angiogram to measure the lesion length. After that they will insert the PTCA guide wire through the guiding catheter into the coronary artery, and visualizing the coronary artery lesion by injecting contrast. After that, advancing the guide wire across the stenosis or blocked area. Then the selected guide wire will then be passed through the catheter and into the artery. After that they will introduce the stent balloon catheter over the wire and positioning across the lesion, and then inflating the stent according to the recommended pressure atmosphere. After that deflating the balloon stent completely, then removing the stent balloon from guiding catheter and they will inject the contrast to do the check angiogram. After everything done they remove the guide wire and guiding catheter from aorta. Now you can see the pre and post stenting image of coronary angioplasty. Thank you for watching this video, have a great day.